All right, good afternoon, everyone. Thank you for joining us today. Today we are talking all things COVID-19 and testing. And I think we've covered this maybe once or twice before, but I mean, things change every week. So thank you to Dr. Millam for joining us today to talk about this. And so, and if anyone has any questions, feel free to put them in the comments. I'll be watching and we'll try and get to as many as we can today. So just starting off, how can I get tested in Boone County for COVID-19?
Yeah, so there are a few different ways to get tested here. Ideally, this works for folks who have a primary care provider. You call and you do either a phone or a telehealth visit with your primary care provider and you explain why you're interested in getting tested. So this may be you calling in with symptoms, not even getting tested for a COVID-19 on your radar, and your primary care provider saying, this is something we should look for, or it may be you wondering if you have that and wanting to get tested. And so that's the best from a patient perspective. That's the most ideal way to get tested, is talking with your primary care provider to determine, is this a test that would be smart to get? And then they can provide you with an order that you can go to one of the drive-through testing sites to get tested. So then the reason that this is ideal is not just from a protecting the healthcare system and protecting those other people in your community, but as you are all probably aware, the symptoms of COVID-19 are also symptoms of a whole lot of other things. And so if your test is negative, it is helpful to have a provider who knows what symptoms you're having and then can speak to, this is the next step, or this is what else might be likely. So that is what I would consider the best way to get tested. If you don't have a primary care provider, or you're not able to be seen through a telehealth visit with your primary care provider or one of their colleagues, then there are some other options. So both Boone and MU have drive-through testing sites, and they have since mid-March. The VA does as well for veterans, which is really wonderful. And if you go to the websites of the testing facility where you would like to go, they explain how you can get an order if you can't get that from your primary care provider. So I'm going to share my screen just briefly to show you what those websites look like for people who are interested. So Boone's is boone.org/COVID. And so it kind of walks you through, this is how you could get tested. Ideally talking to your primary care provider. If you don't have one or you're not able to do that, then they have a little link to the BJC screening tool that will take you to kind of an online way to determine, do you need an order and how to best get that for people who can't get it from their primary care provider. And then it just has their hours down here and what would be recommended. There's no out-of-pocket cost. If someone has insurance, it's recommended to bring your ID and your insurance card. And then MU's is the muhealth.org. Honestly, this one's a little easier just to Google MU Health COVID or MU Health coronavirus, and this is the first link that comes up. And so this kind of talks about how to get tested here. Under there, who should get tested, you can contact your primary care provider, as we've already mentioned, or they have this muhealthvideovisits.org. So those are kind of the two simplest strategies to get tested here. Also, there are some of the urgent cares are doing testing there. I would recommend calling ahead if you have symptoms of COVID-19 or you've been exposed to COVID-19. Those are really the two indications for getting tested right now in our particular area. And so I would recommend letting your provider know, whether that's an urgent care that you're going to be going to, or your primary care clinic, or any clinic. They should be aware if you have symptoms of COVID-19 or if you have been exposed to COVID-19 to protect themselves, but then also to help evaluate you in the most appropriate way possible. So those are kind of the best ways to get tested, and that your primary care provider does not have to be affiliated with either of those drive-through testing sites. Any primary care provider is able to provide orders that you can take to those places.
Yeah, and we've gotten a lot of questions about if those tests are free or not.
Yeah, so they are free to the patient at this time. So the institutions are not charging patients. They are asking for insurance information for people who have insurance, but people who do not have insurance are not turned away. And people with insurance are with or without insurance are not charged anything directly to them. So there's not a cost to the patient. So this is actually just an unbelievable incredibly important service that the hospitals are providing to not charge the patients for a fairly expensive test.
Yeah. You mentioned the different testings at the clinics and hospitals, but can you talk a little bit about the mobile testing site?
Yeah, so the kind of collaborative mobile testing unit that's been in place since the beginning of May, that was being kind of deployed 3 times a week during May, and now it's on Mondays during the month of June. That goes to certain areas around the community, just trying to improve access to testing for people who are running into barriers, whether that's not being able to get to one of the current testing locations, or if you do have symptoms or a known exposure, but you're not able to get an order for any reasons. That's kind of the populations that mobile site serves, and it'll be at Sturgeon this coming Monday, and then Turning Point the following Monday. And oh gosh, Ashton, I just blanked on the last Monday in June. Where's our final location? I'll pull it up real quick. I'm so sorry, I just looked at it.
In the Parkade Plaza? Or did that already happen? Now, I can't remember.
You're right. Yep. So you're right. The last Monday in June is the Salvation Army Thrift Store in Parkade Plaza. So this coming Monday is the Sturgeon Rec Center. The following Monday is Turning Point, and then the last Monday in June is the Salvation Army Thrift Store in Parkade Plaza. And so that is a site that you do not have to have an order ahead of time. There'll be a provider there who could provide that order, or there'll be a standing order in place. But it is specifically for people who have symptoms of COVID-19 or have a known exposure. So that's really the people who can get tested in mid-Missouri right now, are if you have symptoms or if you have a known exposure. And those people should get tested.
Can you speak a little bit about why people who do not have symptoms or do not have known contact with someone, why we aren't really recommending that they get tested right now?
Yeah, so 2 reasons for that. One is that we do not, so we are really lucky here in Boone County. We have a really impressive testing capacity thanks to the healthcare institutions and GeneTrate, the primary lab that's doing the processing. So we're really lucky, but that testing capacity is still not high enough that every person can get tested however often they want. And so we need to keep in mind that we need to make sure we continue to have testing capacity for people who need the test, people who are really sick. And people who more likely have the illness. The second reason, so that's the first one, is that we don't have unlimited testing capacity, and we really need to be able to target testing to the people who really need it. But number 2 is that it's not a perfect test. No test is. And so for someone who is at much lower risk of having a positive test result in a test that is not perfect, means that you're more likely to get a false result. So by testing people who have a higher, we call it pretest probability, so other risk factors that make them more likely to have it, or likely at all to have it, that increases the chance of that being an accurate or successful test. And so broadly speaking, if we use an imperfect test to test a whole lot of low risk individuals, we are going to have more false results. And that is obviously a problem whenever you look at that happening broadly.
Yeah. And I think one day we were all talking with people here, and someone on our team said, you know, a COVID-19 test, it's a snapshot in time. It tells you if you have it right then. I mean, you could, you know, walk away from the testing site and be exposed and get it later. Like it just is that one time. And I think that's really important for a lot of people to remember, especially if you're trying to figure out if you have it when you don't have symptoms, because you can really get it anytime. Okay, so a lot of questions we've gotten to is, I know someone who is quarantined because they have a contact. So they were a contact. So we call that contact of a contact. But can those people get tested? Like if I know someone who is quarantining, they have not had it yet, they're just taking extra precautions, should I get tested?
Not unless you have symptoms. So this is a really confusing piece, is that, I would encourage people to, and maybe this is just the way my mind works, but I would encourage people to think about quarantine and isolation as kind of two separate branches. So if you have COVID-19 illness, if you have a positive test, you do something called self-isolation. So that would be kind of this branch over here, where you try to not expose anyone to this particular infection. And that ends up being at least 10 days. I won't go into the other nuances of that because I don't think that's probably a good use of everyone's time. However, that's kind of a separate arm with its own specific criteria and timeline. And then you've got people who were exposed to that person. So people who were in close contact, either direct contact or less than 6 feet for more than 15 minutes without wearing personal protective equipment like mask and sometimes even needing goggles and gloves and other things, depending on the type of exposure. But so those are people who have been in contact with, close contact, to someone who has a positive test. Those are what we call contacts, or who we call contacts. So they're in this other branch and we call that quarantine, where they're trying to limit exposure because they have the potential to develop the infection. They do not have the infection, but they were potentially exposed to it. And so they want to be cautious because they could develop the infection, and we still do not want that to be spread throughout our community. So these are different branches, and so they have different recommendations and different timelines, and that's a key differentiating kind of factor. And that causes a lot of confusion for people because they'll hear, well, this person was given this guidance about testing or about number of days to stay isolated, and this person was given different advice about testing or number of days to stay isolated. And they should have been given different information. And so I understand that's very confusing, but I do think that's probably worth spending a little bit of time just explaining that. So then you've got a third category of people, the people who have been exposed to people in this contact category. And these people do not have extra risk, any increased risk, unless they continue to be in close contact to that contact who turns positive. So while someone is in their 14-day quarantine period because they were a contact to someone who had a positive test result, if that contact has a positive test, either because we facilitated them getting tested because of that known exposure or because they develop symptoms, for either reason, they get tested, they have a positive test, say, okay, you have COVID-19 infection. They are no longer a contact. They are now a case. So they then go over to the isolation piece, a different timeline. And now someone who has had contact with them during their time of infection would be contacted by the health department and informed that they are a close contact and they would be quarantined. So those are all very specific situations. And so if you are someone who has been in close contact with someone else who has not yet tested positive, but that person has been in close contact with someone who did test positive, that kind of two kind of jumps, you are not a contact, you are not in quarantine, you are not at elevated risk. If something changes in that scenario and that contact becomes a case, depending on when your exposure was, you may be contacted. But if you were in close contact and they didn't develop the infection until 2 weeks later, you would still not be at elevated risk. So it's all about direct contact during the time of someone's period of being infectious.
Awesome. Thank you so much for clarifying that. You explained it really well. It is a confusing thing, but we have a very dedicated team here who works with all that, works with our contacts and our cases to make sure everyone knows what they're supposed to be doing if they were exposed. Let's move into talking just about testing availability. In terms of our reopening and recovery, we have said many times this is a main factor that we are looking at. So how much has testing availability increased in Boone County, let's just say in the last couple of weeks?
Yeah, so testing availability is adequate right now. we are not seeing a surge because our community is wonderful and is following physical distancing recommendations and requirements. And so that's a really good thing. And so we do have adequate testing capacity for what is needed right now to test symptomatic or exposed individuals. We still have to be on the kind of on the cautious side of we can't just let everything go back to pre-pandemic business as usual, because we do not want there to be a surge that our testing capacity wouldn't be able to handle. I don't know if I answered your question though, Ashton. I don't have a specific number of like how many tests, like the difference between a couple of weeks ago and now, but between the 3 different hospitals and the mobile testing unit, but primarily the 3 hospitals, they've really been able to do the tests that are needed to be done here.
And we actually, on our hub, on our website, we do have a category sub-tab there that will tell you how many Boone County residents are tested each day. I think there might be a couple-day lag as far as gathering that information from all of the different places around the county where you can get tested. But if anyone is curious, you can go check that out on our website. In addition to those hospital testing.
Yes. And I have,
oh, sorry, go ahead.
That's okay. I was just going to say I can share the screen real quick if people haven't seen it before, that you can get to this through the como.gov/coronavirus, and you just go to that information hub. And so you can see that over 20,000 tests have been done. So I just thought in case people haven't checked that out yet, that was a really good reference, Ashton. Thanks.
Yeah, thanks for sharing that screen too. In addition to the different healthcare and the mobile testing, we did have a statewide testing site last week at Hickman High School that was organized by the state, and it was open to anyone who could make an appointment, anyone not even just in Boone County, but the majority of people tested were in Boone County, and I'm pulling up those numbers now because we've had some questions about it. So 1,145 Boone County residents were tested in those 2 days last week. And of that, 4 tested positive. So as the expert, health expert, what do you think of those numbers? What does that tell us?
Yeah, so we have been finding over the past couple of months that our prevalence of COVID-19 in Boone County is low. This is a good thing, and we want to keep it that way. So this number, on one hand, reiterates that we have a low prevalence, which is good news. We are really glad that hundreds of positive cases do not come out of this, and us facing, there's a whole lot of COVID-19 being undiagnosed and spreading throughout our community, which would be a really scary thing if that had been the finding. So it's really great that that wasn't the finding. This also needs to be taken with that perspective of these were low risk individuals. So these were not people who had been exposed, and a lot of them didn't have symptoms. And so like we talked about a little bit ago, for someone who has no known exposure and who has no symptoms and lives in a community where we have low prevalence, the likelihood of their test being positive is going to be lower. And so it just needs to be viewed in that particular light. And so it's really great to know this information and to, again, see it reiterated that it's low prevalence. It's not exactly what we would consider a prevalence study where it would be truly reflective of our entire community. And we've actually, our leadership at the health department has worked with really smart individuals in a variety of kind of organizations to figure out true prevalence here, and is there a way to better gather that data? And we do recognize that we're definitely able to see that we have a low prevalence here. And given the low prevalence here and the imperfect tests that are available right now, doing a broader, widespread prevalence study would actually show us more false results than more false positive and false negatives than true positives, which would be a problem. And so, but I just think it's important for our community to know that, our director and assistant director, Stephanie and Scott, are really looking at just every aspect of COVID-19 and how do we gather all of the data that could be helpful in our response for our community. And this is definitely something that they have been looking into and working through all the different numbers involving statisticians, and that is when by looking at all of that through all of those really thoughtful discussions, they were able to determine that at this given time, given the test types that we have available and their accuracy and imperfectness and our low prevalence, that's not something that would be able to actually give us a more accurate prevalence number. So I think it's just kind of twofold with it would be my interpretation of the mass state testing, is that that's great that it illustrated our low prevalence. I don't think that we can take 4 divided by 1,145 and say that is true Boone County prevalence, though, because it is a sample that was at low risk.
Yeah, and someone specifically asked about the Hickman testing, and they said, I'm assuming that those number of cases were added to our total. Yes, those 4 were added after we got those positive results back. But then they also said, is it plausible to see higher numbers because we are using testing and contact tracing as best practice to avoid an outbreak and quarantine, isolate everyone around the first? I'm sorry. I'm reading the wrong thing. I'm sorry. They asked, I'm curious how much of the surge in cases we've experienced over the past week and a half was from this increased access to testing, and how much was simply due to more folks getting sick and tested due to having symptoms. So we know there's only 4 positives from that. So where are these other cases where are those coming from?
Yeah, so a lot of them are coming from contacts to known cases. So again, just illustrating the importance of isolation and quarantine. So that direct contact or that close contact for a prolonged period of time definitely is being demonstrated as a high risk in our particular area. There also is still community transmission being seen as well. And so it's not just one type of transmission being seen. It's not just close contacts, but that is a large number of them, is that close contacts to people who have already been diagnosed with COVID-19. And so by facilitating testing for those contacts, we are able to identify them more readily, so more quickly, help them become aware of their infection so they can isolate and not continue to spread that. I think that whenever we think about increased testing correlating with increased positives, I'm not sure if that's the right way to look at it. I'm not sure if that's really the accurate perspective for it. So if we didn't test anyone, we would still have this, we would actually have more COVID-19 cases, because it gets kind of tricky, because if you don't identify those cases, then they are going to spread it because they don't know that they need to isolate. So your numbers will actually grow. You may not be able to call them confirmed cases because you're not testing those individuals, but you're actually going to get more positives or more infections present because you're not identifying and isolating people who have the infection and who are spreading it. So it's kind of, I'm trying to simplify it and I'm doing a really terrible job of that. So let me try to kind of reframe this a little bit. So we want to have adequate testing and we want to identify those numbers. So initially you would see, okay, we are seeing positives, we are seeing new cases. Having adequate testing and increasing testing numbers allows for us to identify those cases and to add those to the total now. And by doing that, we're able to recommend those people isolate. So it really decreases the total exponentially in the long run.
Yeah, so from what you're saying, I think it shows that availability of testing is a big part of our recovery efforts because it identifies those cases. But in terms of decreasing the amount of cases, the mitigation efforts is our main tool in the toolbox. The social distancing, the isolating, the hand washing, all of those sorts of things. If we were to take that away, that would likely correlate to more cases rather than just having testing correlate with more cases.
Exactly. Yeah, that's great.
We have just a few more minutes left for today. Let's talk a little bit about antibody tests. So still a lot of news about those statewide and nationally. What can you tell us about the availability of antibody tests here in Boone County?
Yeah, so antibody tests exist. They exist in Boone County. They should not be used to diagnose active infection. And so I could talk about antibody testing probably for a whole hour because it's just, there's a lot of moving parts to it. So I'm going to try to be concise. And I think that is the take home point, is that antibody tests exist, not in high quantities, and they shouldn't exist here in high quantities right now because we shouldn't be broadly using them. So the issues are that it is not 100% accurate. So we kind of go back to what we were talking about earlier. If a test is not 100% accurate and you test a whole lot of people who are at low risk of having had that infection, you are going to get a certain number of false positive and false negative results. So that's why we aren't able to use the current antibody tests in our current low prevalence community broadly, is that we would get more wrong information. It would be very detrimental to give people inaccurate information, which is what could happen. And we would see more of that than we would see as far as identifying those true positive results. So that's kind of one piece about thinking about why we're not using it to test people broadly right now. The other piece is that we don't know, meaning the scientific community, the medical community at large around the world at this point in time, the evidence does not demonstrate if having a positive antibody test confers you any immunity. So it also becomes an issue of many people might get an antibody test that would be positive and say, well, I have antibodies, that must mean I am protected the way a vaccine would protect me. And that is not shown to be true at this point in time. So we hope that that is shown to be true at some point in the future, and then the guidance can change on this. But right now, that is not the case. And then that kind of leads into, on an individual level, if you call your doctor and say, I think I had this infection a couple of months ago, so can we please do the antibody test so I can see if that's what I had? So one, it would be, what is the benefit of that test? It's not going to tell you if you are immune or not. It's not going to tell you if it should not guide your behaviors or how much risk you're taking or how cautious you're being. It really doesn't offer you any clinical value other than to possibly answer a curiosity question. Because the test is not 100% accurate, it's not fully going to answer that curiosity question, is the issue we run into. And so right now, it should be used for research purposes or clinically only in a very small subset of patients who are around like day 9 to 14 of symptoms. They and their provider that they are working with feel really strongly that they think this is current active COVID-19, and they do the nasal swab and it's negative. So this is a really specific subset that is going to have to be really a conversation that you have with your provider. That is not going to, that situation doesn't happen very often. I think most of the people wanting to know about antibody testing had symptoms months ago. They are recovered from the illness. And so I think it's just important to know that that antibody test right now does not give you any benefit to do. It doesn't give you any knowledge other than maybe answering a question of curiosity, but then you run the risk of a false result, and then answering that curiosity question with a wrong answer, kind of a bag of worms.
Yeah, well, thank you so much for joining us today. I feel like every time we talk, I learn something new. So I appreciate that. And I know a lot of people watching appreciate it too. So thank you so much.
Thanks, Ashton.
We will
Thanks,
see.
Shelby.
Thank you to Shelby too, our interpreter. And we will be back next week to talk more things COVID. And if you have any questions, feel free to reach out on Facebook or email us at coronavirus@como.gov.